is Dr. Alise, and I will be examining you today. How are you today? Good, okay. Now, is this your first time at our clinic? Okay, sure, so let's just start a new client profile for you. And did you receive a referral to our clinic today? Okay, and that was from Dr. Okay, got you. Alright, and you just let me know your first and last name. Okay. Oh, could you spell the last name for me? Okay. Okay, yeah. You're coming up here as our referral from Dr. Johnson, right? Okay. Now, could I please ask your date of birth? Okay. And offhand, do you know your height and weight? Yeah, an estimation for the weight is fine. Okay, thank you. And then I'm just gonna ask you about some of your habits relating to your health. Starting with, do you exercise? Okay. And what sort of exercises do you do? Okay, yeah, jogging is good. Okay. And about how many times per week? Okay, 3 to 4. Yeah, that's great. And then for one episode of exercise, one occasion, how long would that last? About 30 minutes, an hour? Okay, very good. Okay. And then I just wanted to also ask about your diet. So if you could just describe a typical day of eating for you. Okay. So you do eat breakfast. Wonderful. A lot of people skip breakfast these days, but I always say to try to get in your breakfast. Do you have any dietary restrictions? Vegetarian, vegan, gluten-free, anything of those sorts? Okay. Okay, so you are lactose intolerant. Okay. Do you still consume dairy? Sometimes? Yeah, me too. Okay. Okay. And then, would you say you eat meat every day or every other day? Every other day. Okay. Just on the days that you're not eating meat, make sure you're getting enough protein from other sources, like soy or any beans, nuts, legumes, those types of things, okay? Do you drink alcohol? Okay, and about how many times per month or per week, however it's easiest to say? Okay. Yeah. Okay. And do you smoke? Okay. Any other recreational drugs that you would like to tell me about? Okay. Alright, and I wanted to ask, how has your sleep been in, let's say, the past 6 weeks? So about how many hours per night do you get on average? Okay. Yeah, I would like you to get a bit more sleep. 6 really isn't cutting it. I'd like to see you at least get 7, 7.5. 8 would be ideal. Okay. And do you have any pre-existing health conditions that you're aware of? Okay. And currently taking any medications? Okay. And okay. Do you regularly take any over-the-counter medicines such as Advil, ibuprofen, the allergy medicines? Okay, allergy medicine in pollen season. Yeah, there's been a lot of pollen lately, right? Okay. And do you have any history of surgeries that you would like to disclose to me? No, okay. Okay. And then briefly, I would like to ask about your family history. So, starting on your mother's side, is there any history of disease, illness, any sort of conditions that I should be aware of? Okay. Okay. Okay, and then on your father's side as well, please. Okay. Thank you. And now finally, what brings you here today? So I saw on the referral letter briefly, Dr. Johnson said that you had been experiencing symptoms of migraine headaches. Is that? Yeah, you could tell me a bit more about that. Okay, so migraine. Okay, and when did those migraine symptoms begin? 5 days ago, okay. And is this your first time experiencing these symptoms, or do you have a history of migraine headaches? Yeah, you didn't mention that before, so this is your first time. Okay. And then if you could, generally, before we get into the symptoms, your current pain levels right now, pain and discomfort, if you had to rate them on a scale of 1 to 10, 1 being barely any pain, you're doing really well, and 10 being terrible, terrible pain, you cannot bear it. Where do you fall on that scale? Okay, so about a 6. That's not good. We don't want you at a 6. We want to get you down to a 2 at least. Okay, preferably 1. So now I want to ask you to break down your symptoms a bit. So, what sort of pain are you experiencing? Would you describe it as dull pain or any sharp pain anywhere, or kind of a lingering achiness? Okay. Dull pain around. Is that on one side of your head? Left side, okay. On left side of the head. Okay. And okay, so you do get some sharp pains from time to time. Is that if you move a certain way or just completely out of nowhere? Okay, if you turn your neck a certain way. Okay. Do you mind if could you turn your neck to the left for me? You feel a bit of a sharp pain, okay? Could you turn your neck to the right for me now? Okay, so sharp pain when you look to the left. Okay, yeah, that's important. Okay, and then aside from the pain, are you experiencing any numbness or tingling? Like pins and needles around. So a bit on the left side of the face. And Okay, back of the head. Okay. Oh, and your neck as well. Are you experiencing pain in your neck? Okay. Shoulder, neck, shoulder. And is this also on the left side? Okay, so left side. Okay, I think to get a better idea of where these symptoms are centered, I would like to use a symptom mapper in just one moment, but I wanted to ask if you've experienced any nausea or vomiting. No, okay, that's good. Okay, and what about any dizziness, loss of balance? Okay. Okay, so just a bit dizzy if the pain becomes really severe. And when did that occur? Yeah, that dizzy spell, when was that? Yep, yesterday. Okay. Okay. And then just light sensitivity or sensitivity to noise. Okay, not so much. Okay, because the typical migraine, lights will seem really bright, noises will seem much louder than usual, those kinds of things. So interesting that you're not experiencing that. Okay, no worries. We will get to the bottom of this. And then I just also wanted to ask, have you been hit in the head recently or even in the past couple years? Any significant hit to the head that you can recall? No? Okay. And then on to the symptom mapping that I was talking about here. So I'm going to show you this, and before we start mapping it out, this is for the front of your body, and this would be your left side, and this would be your right side. So left side, right side. We'll start here, okay? Let me just pull up the pen. We used to do all this on paper, but recently they've made me go full digital, and I'm not used to this yet. Okay. Okay, here we are. Sorry for the delay. So, select the pen. Okay, I think this should do it. So, this is, again, I'll just write an R, it's an L, and then for the back, this would be L and R, and then we'll say this is L for the side. Yeah. Okay, so we have right and left, and then when you turn around, left and right, and then this will be the left side of your body since that's where you're experiencing your symptoms. Okay, so if this is the left side of your head, you're feeling some pain centered around this area and some tingling on the left side of the face, right? And then you said the neck as well here, some tingling going down into the shoulder, and some pain in the neck, the pain in the shoulder. Okay, and then down your left arm, I wanted to ask, have you experienced any sort of pain or tingling, numbness in the elbow or the hands, fingers? Okay, a bit of numbness in the elbow. What about pain? Not so much. Okay, and then what about your fingers? Do you experience any numbness or tingling in the fingers? Sometimes? Okay, so just a bit. Okay, and then have you felt any sort of these symptoms in the left leg? Going from the hip, knee, down to the foot? No, okay. So it's just concentrated to the upper extremities of the left side and face and head. Alright, now looking at the back side here, moving on to here, the back side of your body. I was wondering if the back of your head, you were experiencing numbness, right? Was that only on the left side, or does it travel to the right side? Okay, a bit to the center, left side. Okay, and is that more the lower back of the head? What about the top parts? Just the lower part, okay. And then you said neck as well, tingling and pain. And then how about the back? Anywhere towards like the spine. Okay, so some pain in between the shoulder blade and the spine. Now what sort of pain is this? Is this like sharp pain or like a muscle pain? Okay, so this is some muscle pain here. Okay, and then how about in the back of the arm? Okay, a bit of pain in the back of the arm. And again, is that like muscle pain or more nerve pain? Not sure, okay. That's okay. Alright, and then just add to the elbow here, to those fingers again. And then what about the lower back, middle to lower back? Mostly okay. Okay, it's good to hear. Alright, and then for the left side, so I'd like to get more specific, looking at the left side of the neck here. Okay, so so pain here, and you said feeling some tightness. Okay. Okay, so tightness of the neck area, and then up to the elbow, and then transfer this sort of pain from the shoulder. Okay, yeah, I can mostly fill in here from what you had told me previously. Oh, could I ask about your wrist on the left side? Mostly okay? Alright. Alright, so this may look like a bit of a mess to you, but this is a very clear map for me. This will actually be very helpful for me, so I'll be referencing this throughout our tests for your examination, okay? Thank you for that. Okay, so moving on from that. Okay, now that I have a good idea of exactly where you're experiencing the pain and numbness, I just wanted to palpate around some of those areas and get your feedback about when you're feeling any pain or tenderness, okay? And then feel some extra areas that you didn't mention and just check to see if those are affected as well, okay? So I'm going to start out with your face here. Could I have permission to touch your face? Okay, thank you. And let me know if the pain is unbearable or if you need a break or anything. So I'm just going to start out with your right side for comparison, and then I'll be doing your left, okay? So just starting on the right cheek. Do you feel any pain, discomfort, or tingling? Okay, and I'm just going to move along the face, and you can tell me if any feelings change. Okay, to the forehead. Just moving to the center of the forehead here. And now moving to your left side here. Okay, so it's becoming a bit tender right around the brow bone of the left side. Okay, Okay, could you close your eyes for me? I just wanted to feel very gently on the eyelid of the left side. Okay, so it's more around the bone around the eye and not so much the eye itself. Okay, and then your temple. Okay, so your temple is very, very tender and painful. Okay, okay. If I move down the cheek, so not as bad on your cheek, okay? Alright, and then I wanted to feel up into the hairline because sometimes migraine will cause tenderness of the hairline, so I was wondering if I gently brush my fingers through your hair, do you feel any extra pain, tenderness that normally wouldn't be there? No? Okay. Just take a note of that real quick. Okay. And I'll just continue now going down your neck. If you could just actually first just stay relaxed and then I'll ask you to look up. So I'll just be feeling down the neck here. Okay. So I am noticing a difference in your tissue on the left and the right side. Your right side feels pretty normal. It is a bit tense, but nothing too alarming. However, on the left side here, it is quite tight, and I can actually feel, if I just hold my hand around this area, I can feel even a bit of, did you feel that? A bit of almost like twitching of the muscles in this area. So, I didn't ask this earlier, but about how many hours a day do you spend looking, let's say, down at a computer screen or phone? Okay. So you work in front of a computer most of the day? Okay. So I have a feeling that your posture has a lot to do with what I'm feeling in your neck right now. So let me just take a note of that. Yeah, you would be surprised how much stress it puts on our neck. Even if it's just a few degrees forward out of alignment, it puts so many more pounds of stress on your spine, spinal cord, the neck, everything in this area. So it's really something to be cautious of. But okay. Now I'm just going to be feeling around the back of the neck, which is quite tense as well, especially on this left side, and going down into the shoulders. Okay, I'm going to start up here on your right shoulder. Just feeling quite normal. Does this feel okay? Do you feel any pain right now? Good. Okay. I'm going to come over here to your left shoulder now. Okay. Yeah. Okay, so when I press here, you're feeling a bit of tingling in the face, about left side of the face. Okay. And now if I come up and press on this part of your neck, do you feel any? Okay. So when I press on these two spots, a bit of tingling in the neck. Okay, do you mind if I just feel a bit down your left arm? Okay. Okay. Oh. Felt an elbow? Okay. The elbow's a bit tender, yeah. And then what about your hands? I know that you said sometimes you felt a bit of tingling in your fingers. So what I'm gonna do is I'm just going to pull back on your fingers like this, each one individually. So if you could just offer me your hands like this and just relax them just normally. Okay, and I'm just gonna press down starting from your pinky and let me know if you feel any sensation, pain, tingling up throughout the left arm, the neck, the face, anywhere, okay? Okay, starting with the pinky. Okay, pinky. Okay, and the ring finger, do you feel any? Okay, a bit here. Middle fingers, okay. Okay. So, pinky and ring finger. You felt in your face. Did you feel anything in the elbow? Elbow as well? Okay. Alright, that's actually what I was kind of expecting after what you felt in your neck and shoulder. Yes, so actually you do have lines of nerves that run all the way from up to your head, down the neck. Quite a bundle of nerves here in the front of the chest and near the shoulder. And then running all the way down to the elbow, the arm, all the way to your fingers. So yeah, that explains why when I touch down here a certain way, you could definitely feel it going all the way up that side of your body. Okay, so that tells me there's certainly something going on with the nerves somewhere there on the left side of the body. I have a feeling it's relating to the tension and potentially inflammation of the neck, shoulder, even back muscles. But I would like to do a few more sets of tests just to check another few things because I didn't like, just to make sure there's nothing going on with your optic nerves because you said you were experiencing some pain in that eye, right? So I just want to rule out any potential problems with your eyes. Okay, and then I'll do a few other sets of tests. So, okay. First, what I'm gonna do is just simply take a look at this left eye. Okay, try to keep it open for me. Okay. Just for comparison, your right eye here. Okay. As far as I can see, I'm not seeing any abnormalities. Okay. Yeah. Okay. Now if I could just have you take a look at this fluffy white thing and just follow it as best as you can, okay? I'm just going to be watching how your eyes move. Okay. Is this uncomfortable or even painful for you? Feeling okay? Okay. Alright. So no pain with that. Okay. I just want to have you watch my nose. Just keep your eyes on my nose and let me know which finger is moving for you, left or right, okay? Ready? Mm-hmm. 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 Okay, very good, very good. So I don't think there's any sort of issues with your optic nerve. Everything seems to be perfectly fine. And the pain, when I had palpated earlier, you said wasn't actually on the eye itself, but more so in the, tissue around it. So I don't believe you have any sort of issues with the optic nerve. However, I am going to have you do an MRI of the brain and all the cranial tissues later, just to rule out any sort of problems. But don't worry, don't worry. Where was I? Okay. Yeah, so all finished with the eyes. Okay. So next I would like to test out your sensation of touch. So first of all, what I'm going to do is I'm going to touch the right side of your face, just like this. So just become familiar with the feeling of the soft white part here, okay? And now if I touch the adjacent on your left cheek, does this feel the same as this? Okay, and then what about if I go up to the right side of the forehead and the left side of the forehead? Same, different? Okay, and then if you could just move your hair behind your ears for me. And I'm gonna feel the right ear. And then how about the left ear? Same or different? Okay, one more time for me. Okay. Alright, and then down here a bit. Going down to your neck now. Okay. Alright. I'm just gonna take a few notes on that. Okay. So now what I'm gonna do is just focusing here on your left side. I'm going to be touching you with either soft or sharp. Soft or sharp, okay? So just get a feel for what this sharp side feels like, okay? And just close your eyes for me. Okay, and let me know what you feel, soft or sharp, okay? Okay. 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 And now I'm just gonna be moving down here to your neck, okay? So okay. And okay. So you did quite well on that. I would just like to repeat on your hands. Okay, so if you could please give me both hands. First of all, just let me know if this feels the same as this. Okay, and then focusing here on the left side, let me know if you're feeling sharp or dull, okay? Okay. Okay. pretty well. You did make an error one time, but nobody's perfect. Okay. So now what I would like you to do is close your eyes for me, and then I am just going to softly touch, not with my hands, with this one part of your body that we had just tested, and you just name the body part that I touch. For example, if I touch your face, just say face. And specifically, if it's your right cheek, say right cheek, left cheek, say left cheek, okay? Got it? Okay. Starting now. Elbow. Okay, left shoulder. Left eye, yeah. Right cheek, okay. One more time. Left ear, yeah. Okay, and neck, very good. Right hand, and left hand, okay. No problems there. Absolutely not an issue there. Okay. And now what I'm going to do is I will be touching you with an item that is either warm or cool, hot or cold. And I want you to just close your eyes and let me know if you feel hot or cold. Okay? So just close your eyes here. Okay? And put here. Cool. Okay. Here. Cool. And here. Warm. What about on your neck down here? Okay, one more time. Yeah, that was cool. How about over here on the right side? Warm. Good. Okay. And just your hand for me. Cool. Here. Cool. And warm. Okay. Yeah, not bad. Okay, not bad at all. Okay. So now I would like to switch gears a little bit, and I wanted to test the strength and mobility of your neck and head area. Yeah, so first of all, what I want you to do is I'm going to put my hand on the right side of your head, and I just want you to try to turn against it. Yeah, try to turn your face against my hand. And don't let me push your face. Good. Okay. And then here on the left side as well. Okay. Yeah, the left side is a bit weaker. Try one more time here. Push against my hand. Okay. And now, same thing, but put my hand on your right shoulder. Just push against. Don't let me push you over, okay? And then on the left side, just push. Okay. And now I want you to try to look down, and I'm going to be pushing up against your chin. Just resist against me here, okay? Okay. And now, similarly, I'm gonna kind of hold your head. I want you to try to look up. I'm gonna try to prevent you from looking up, but just resist against me. Okay. Okay, and then real quick, I'm just gonna place my hand on your cheek here, and with your tongue on the inside of your mouth, just press against my hand as strong as you can. Good. Okay, and then over here on this left side as well, just strong as you can. Okay. Would you do right side again? And then left side. Okay. Okay, no problems there. Okay. And now I want you to squeeze my hand as tight as you can with your right hand. You're real strong. You're not gonna hurt me. Okay. And then your left side, please. As hard as you can. Okay. Your grip is actually pretty equal from what I can tell. So it doesn't seem that your strength has been compromised too much. However, you did note you experienced some pain when doing the left side often, okay? Okay. So now this is more about balance, more so than strength. So I want you to close your eyes for me, and then I am just going to gently push you one way or the other. I'm not going to throw you to the ground or anything, but just gently give you a push and try to just maintain your balance for me, okay? Okay. 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 Good enough. Okay, and now lastly here, watch me real quick about what I'm about to do. So take my right side and I come and I touch my nose, bring it back out, touch my nose, bring it back out. Okay, I want you to close your eyes and copy exactly what I just did, okay? So close your eyes and then just do exactly what I did. Okay. Now you can open your eyes. Okay. And then I want you to come touch my opposite hand. So right hand to my left hand to my right hand. Just like that. Okay, and then stay still for me. Just your bones. Okay. Okay, very good. Didn't experience any sort of disorientation. Balance is intact. Okay. And then one of the last tests that I wanted to do for you, I wanted to check your reflexes real quick. So just starting with your elbows here. Yeah, if you could just let me. You seem to be a tough one. Okay, there we go. Okay, and now on the left side here, this may hurt a little bit. I'm so sorry because I think your nerves are quite tender right now, but just. Okay. Yes, good. Okay, and just your wrists for me. If you could just rest your elbow here like this and just let your wrist hang limp like that. I'm just gonna take this one and do. Okay. Your other wrist for me. Okay, wonderful. So, and then I do have to just check your knees as well. I know you're not having any problems down there, but just part of the process. If you could just let me. Okay. Yes, you do have reflexes. So good. So great. Okay. Yeah. You do also, for your information, have some but I could check in your ankles, but because your knees are fine and you're not having any issues down there, we're gonna pass for today. I'm not gonna make you take your shoes off. Okay, so you just give me one moment here. I'm going to write up a quick summary of your examination, and then I'll let you know your diagnosis. Okay. All right. So what I believe is going on with you is pinched nerve or multiple pinched nerves here on the left side of your neck. Have you ever heard of a pinched nerve? Have you ever experienced this before? Okay, it's the first time, yeah. So what I think you're experiencing is a pinched nerve, which basically happens when an excess of pressure is applied to a nerve or a group of nerves. In this case, the neck is actually quite susceptible to becoming pinched, the nerves of the neck, because it's a pretty tight area if you think about it. There's a lot of nerves here coming straight out of your head, and you have your spine. There's so many muscles here. There's lots of tendons. You have your shoulder right next door. You have your whole rib cage here. There's a lot going on. You have your clavicle bone here, and then so there's a lot of things that could cause this to happen. So, for example, inflammation surrounding these nerves, inflammation of the muscles and the tendons could increase in size and put pressure against these nerves. They could become compressed, and when they can become compressed for so long, they start causing these symptoms of tingling, numbness, and pain as you have been, and that's when we call it a pinched nerve. Technically, nothing is, nobody's pinching it, but just the name. And other causes could be poor posture, as I said, when the head is protruded forward for very long periods of time. That also puts quite a lot of strain on this area, on the neck, on the shoulders, all of the above. Yeah, that's never a good thing. Yes, and one's sleeping position could also contribute to a pinched nerve. For example, especially if you are a stomach sleeper and turning your head, kind of cramping up your neck like this to the side. If you think about it, you sleep 6 to 8 hours a night. How many nights a week? How many weeks a year? That is a very large number of hours that your neck is in this position. That is a lot of pressure that is building up on the nerves and the tendons and the muscles here over years and years of your life. So we do recommend sleeping either flat on the back with a quite supportive pillow, or if you are a side sleeper, not staying on one side too long, sort of switching day to day or even throughout the night if you can, just to make sure that not one area is receiving too much pressure at a time. Okay, and then, so another reason why I believe that it's a pinched nerve and not a migraine is because you were not experiencing some of the telltale signs of migraine. For example, the light sensitivity, the sound sensitivity, certain sensitivity of the scalp, and your vision was intact, and your eyes were not showing any, sort of dilation of the pupils, anything like that. So, yes, and then finally, because of how I sort of explained before how the nerves are very, very connected throughout your body, especially this line. It's pretty much tracing out exactly where you're feeling your symptoms. so that is a sure sign of a neurological problem. And then finally, when I was palpating along your neck there, yeah, I could even feel a change in the condition of the tissues around the nerves from right side to left side, which would most definitely put lots of pressure on these nerves. So with all that in mind, how can we treat this? So the good news is that a pinched nerve is not chronic. It will not last forever. However, I do want to say to be careful. Even though in most cases it will go away on its own, if such compression of the nerves is continuous for a very long period of time, let's say weeks to months, then you can start to have some permanent nerve damage or neuropathy, where you'll start to get some pain in the affected areas that could be chronic. And we do not want that to happen. So I have come up with a treatment plan for you, which I'll type up as I let you know. So first and foremost, we want to eliminate the cause of the pinched nerves, which is inflammation of this area, which we will confirm with an MRI later today. But to alleviate that inflammation, we're going to start you on a massage therapy plan, just to really get out the tightness and inflammation of the muscles and tissues. And then we can also try some rounds of TENS. It's like electric therapy. Basically, it is applying very low level shocks to the affected nerves, which is shown to relieve the symptoms of nerve compression, pinched nerves. Okay, and then I would also like to start you in physical therapy after we have relieved the initial inflammation and pain of the tissues and muscles here. I would like to put you in physical therapy to then strengthen these muscles, not just the muscles of the neck, but the shoulders and the back on both sides, and correct the posture that could cause a lot of stress and inflammation in this area, okay? Also just generally increase flexibility and mobility of the area. That'll just make sure that this doesn't happen again, because like I said, we don't want continuous and repetitive compression of these nerves because it could cause permanent lasting issues. So we want to alleviate this and then prevent it from coming back, okay? So I'm just going to write up those details of your treatment plan. I know that is a lot of information. Do you have any questions for me? Okay. Yeah. Okay, so yeah, currently over-the-counter pain medication is perfectly fine. Just take as directed on the bottle. And then if you take the appropriate amount of, let's say, ibuprofen or Advil, which is what I would recommend, and let's say you take the appropriate amount, 400 milligrams, and you are still not getting any relief, you can contact me and I can send in a prescription for a stronger pain medication for the short term, just until we can get the symptoms down. Okay. Yeah, of course. Yeah, that's no problem. Okay. Oh, and do you have any allergies to any medications by chance? Okay. Just have to ask. Okay. So from here, I'll just write up the treatment plan along with finishing up the summary, and I'll have it sent to the front to be printed for you on your way out, and then I'll also have it sent to the email we have on file for you, okay? Okay. Alright. So at the front you'll receive those, the summary and the treatment plan, and they'll also have you reschedule follow-up appointment in a few weeks to see how you're doing. Okay, and then if you want, we also have physical therapy and massage therapy treatment here on site with our clinic, or if you want, you are perfectly welcome to go anywhere that you like. But if you do want to start treatment here, we can get you an appointment on your way out as well. Okay, yeah, you can just mention it to the receptionist and we can get you an appointment. Okay, so I'll finish this real quick. Okay, anything else? Any questions today? Okay, thank you so much for coming to see us today, and we're gonna solve this problem together, okay? Take care, rest, okay? Don't do any sort of crazy activities, or don't go to the gym, okay? Just give it a rest and be easy on yourself, okay? Yeah, and not too much like phone or computer time. Don't do that, okay? Okay, thank you so much, okay? Take care.